Have you ever thought about working in aesthetic medicine? It's a pretty popular area, and I see a lot of people talking about wanting to go into it, and they have a lot of questions about how to do that and what the practices entail. So today I'm talking to a PA who started out with kind of a niche practice within another practice, but now she owns her own aesthetic practice. We're going to talk about aesthetic medicine, what it actually entails, what kind of procedures you do, how you get trained to work in it, the pros and cons, and what things you have to think about if you want to open your own practice. So if that's something that sounds interesting to you, please stay tuned.
Hi there, my name's Cheetam Galley. I'm a PA. I've been practicing for nearly 10 years now, and I work in aesthetic medicine.
Thank you for joining us today, Cheetam.
Oh, well, thank you for having me.
So tell us a little bit about your career path from graduation until what you're doing now.
Sure. I actually went to PA school really with the intentions of going into aesthetic medicine. It worked out that when I did graduate, however, I had an old friend of mine who was a OBGYN who really wanted me to kind of help him out for the summer. And he had just lost his nurse practitioner and he worked in women's health and he did a lot of clinical research. And I said, okay, yeah, sure, let's go ahead and I'll help you out for a few months and fill it in. And I went ahead and I started there quickly. I started looking for a position in aesthetics, and I had some providers that were ready to train me and were willing to take me on. I had made some connections when I was doing my rotations. So I lined up a position that I thought would be my perfect new home. And I approached him and I was like, this has been a great opportunity for learning. Thank you so much. And I'm on my way. And he said, no, you're not. You just stay with me and we'll get you all the training you need here. And you can do your little aesthetic medicine thing here on the side. And he had a great women's health practice that he built up over many, many years. So he kind of gave me an offer that I just couldn't refuse. And I thought, I can get some great training here and a lot of experience. But the only little thing that he had there was he was like, this is going to be your baby. Like, you're going to have to deal with everything. I went ahead and got all the protocols ready. I went to trainings. I was shadowing other plastic surgeons, derms in that time as well. It took about a year. I built up a very nice practice for him. And then I got pregnant. And I had actually had my first daughter at the time. And I had started working early, when she was very young. And I kind of was starting to feel a little bit of that guilt, like I'm not spending enough time at home with the kids. This one, I'm going to make sure that I have more time. So I parted ways and I had my daughter, and then I missed like I missed it. And so, I said to myself, I have all the experience a lot of experience here. I started a practice for him that flourished and did well. I can do this again. This time I can maybe do it on my own. So I started working in like a little tiny salon suite. And it was great, but it was really tough to get patients to come in because I didn't have that patient base that I had from before. That I think was the biggest struggle, trying to get people to come in.
So let me back up a little bit. So you're saying that you actually in an OB/GYN clinic built a little niche aesthetics practice.
We did clinical research for women's health. So we did tons of women's health visits.
Yeah.
And so during their visits, I would do, my health visit, and then I would do my facial assessment on them and then recommend treatments for them. And it worked really well, actually. It did very good.
That's pretty cool. And I just want to highlight that because if somebody's interested in doing aesthetics and they're like you, they're working in an OB/GYN clinic and stuff, it's something to think about, even if they're in family practice. You're seeing a fair amount of women. Maybe the practice is open to letting you start your own aesthetics practice within it. So I think that's something that a lot of people may not even think about. They might think they have to go find just an aesthetics practice or go into derm specifically.
Absolutely. I put in many, many hours after work. I would go just to shadow like other injectors, other providers, just to learn. I would do multiple trainings. Like that is, you really need that experience.
Yeah.
So you have to be willing to put the time in.
Talk about some of the dangers of aesthetic medicine if you don't know what you're doing.
Over the years, I've become a national trainer for Versa, which is a filler product, and then a neuromodulator, Jeuveau, and I also train for Mint PDO Threads, and then I also train privately. And so I've become kind of like the local authority for providers that have issues, and they send their patients to me, and I see all kinds of things. I mean, from occlusions to just improperly placed filler, it doesn't look right, dropped brows. I mean, there is just a field of things that can go wrong. And then you also have a slew of risks that could happen. I mean, you can have, like we mentioned, blindness, you can have an occlusion, you can get necrosis. I mean, there's just things that we don't like to talk about, but the face is full of vessels, right? And for the most part, a lot of the areas that we are treating, you get pretty close to those danger zones too, where you're worried about, okay, am I close to this artery that's going to occlude. So the proper training is critical. And you really do need to spend a good amount of time really understanding the products that you're using, the techniques that you're doing, the anatomy. There's a lot involved in that.
Before we get to talking about more like how you get that training, let's talk a little bit about what aesthetics medicine is. What kind of procedures in general, like what are the top procedures that somebody does in aesthetic medicine?
The most common is, of course, Botox. Neuromodulators are big. It's like the step in, right? And then the second would be dermal fillers. It's revolumizing the face. It's lifting. It's really treating the aging process when done appropriately, right? The third most popular treatment that I do in my office in aesthetics is PDO threads. So, and that's where we're actually lifting the tissue physically. So you combining those three treatments can really create a natural, beautiful result for patients that will slow down the aging process.
So it's pretty much all some kind of injectable or something you're implanting it into the face. Do you work with like creams and different things like dermatologists do as well? Or are you just on the procedure side where you're putting things into the face?
Yeah, so we provide skincare treatments, skin tightening treatments. If there's like hyperpigmentation, we treat that as well with creams, prescriptions. We have medical grade skin tightening treatments, of course, RF microneedling, laser hair removal. So we try to treat every portion of the aging process and the beautification, of patients. So yes, we do offer more than just injectables in our office.
If you're looking to own your own aesthetic clinic, what kind of other personnel do you typically hire in?
You need someone that's going to be almost like an office manager. And that's where my husband came in actually, because I needed someone that I could trust. And he's been wonderful. He deals with a lot of the finances. He deals with a lot of the ordering. He deals with, I mean, a lot of the business side of the practice. So yes, a very good office manager. And then of course you're going to need someone like a receptionist, at least one to start, but ideally you want to have two. If you're not doing your own laser treatments and your own RF microneedling, skin tightening treatments, you're going to need someone that can do that for you, whether it's an RN or a PA or a laser tech, depending on your state. You're going to need a medical assistant to help you, right? To help the practice run a little bit smoother. And, you want to be as efficient as possible. And then, of course, a medical director if you're a PA or nurse practitioner, right?
Do you have any idea of what a typical range would be for what an MD charges to be a medical director? And I know this is highly variable depending on how involved they are, but can you give somebody just a ballpark?
It completely varies. I've seen from a few thousand to partnerships. Usually it starts with at least a few thousand, 2 to 3 thousand.
Do you ever prescribe anything in your, like actually sending prescriptions to pharmacies and things?
So yeah, I mean, we don't do a lot of prescriptions, but if a patient's coming in for like lip filler and they've had lesions before, I'll go ahead and prescribe them like a Valtrex prophylactically. And then if you have patients that have issues, like if they have swelling, you want to take care of them with steroid and possibly antibiotics. So that we are prescribing, it's not a lot, but this is medicine at the end of the day. If there's a patient that has a complication, you do want to treat them accordingly.
So, what are some of the other issues or things that people really need to think about that are that can be difficulties in starting your own practice?
Monetarily, it's definitely not something easy to get into. You have all the product cost that's involved, which is huge. The devices are like six-figure devices, like they're very costly. It's not an easy endeavor to just bring in a device. And then, you want to have a nice welcoming spa, so that, of course, right? And then you want to have a nice website. You have to have a great social media because that's what everything's about. And then, of course, all the protocols and the consents and the documentation that gets involved. Are your notes appropriately written so that you are covering yourself, God forbid, when and if there is an event? Because we're all going to encounter something. Do you have protocols in place for occlusion? Do you have protocols in place for the patient that's unhappy? And then if you have staff members, do you have ways to make sure that they're in a safe environment and if something goes wrong with them? So I have an attorney that anytime I have questions, she specializes in specifically in the med spa space. There is a lot involved that I think a lot of people don't really think about when they're just you're like, oh, this is fun. Let's do some Botox and fillers. It'll be quick and easy.
What about malpractice insurance? Is there anything different or, different coverage or anything else to think about in aesthetics?
So if you're, working on your own and you have your own practice, then you're going to be covering your own malpractice insurance like you would. We cover our medical director's malpractice, and then if you have an injector, then you'll have to cover theirs as well. And then if you have a esthetician, if they're doing any treatments, you'll be covering their malpractice as well. And then if you're working for like a med spa, for example, typically they should be covering that for you. I've seen some offices that don't. You have to cover your own med mal. So I think that varies from practice to practice, but it's not going to be much different than what you're already doing. You just have to make sure that all the treatments that you do provide are included on that
Okay.
service.
So if you're looking to work in aesthetics, but you don't want to open your own practice, where do you normally see people working aesthetics that when it's not their own practice?
So it's typically like a medical spa, right? Some sort of franchise or PA, nurse practitioner, physician owned practice. I see like dermatologist office do a lot of aesthetics. Plastic surgery offices do a lot of aesthetics. And then you'll see the little sprinkle of, maybe some family medicine doctors or some OBGYN doctors. And they like kind of get into it, but they never really are getting into the full treatment, right? So they'll do a little Botox, a little bit of fillers, and then it kind of stops there. They're not doing like the skin tightening and the skin rejuvenation and everything else that's involved.
When you say that there are people doing aesthetics in like a plastic surgeon's office or dermatology office, is it often that you are specifically the aesthetic person, or are they usually doing all the other stuff in the specialty and doing aesthetics as part of their practice? Does that make sense? Or is that usually their own specialty niche in that practice?
Yeah, it's a great question. And I see it both ways. Generally what I see is if it's a med spa, they're just doing injectables and usually they're actually doing lasers as well. I also see a lot of PAs and nurse practitioners that will work with a plastic surgeon and they'll do OR, they'll be in the OR with them and first assist, and then they'll come in and they'll do injectables, they'll help with consultation and follow up. And then with derms, I see a lot of PAs also that are doing skin checks and they'll also be doing injectables. So you can, like, if you love dermatology and you want to maybe step into a little bit of aesthetics, maybe the derm that you're working with doesn't really like injectables. So if you're interested, you can offer to possibly bring that onto the practice and do a little bit of both.
This is probably unfair, but when I think about, working aesthetics, I feel like you're either going to be encountering people who are just never satisfied or who want you to do kind of crazy stuff. Do you see a lot of that, or am I just making that more of a thing than it is?
I see it all day long. I see a lot of patients that come in and they're overtreated and they want more. I have some patients that come in that really, they're doing it for the wrong reasons. I have patients that no matter what you do, they will never be happy. They have unrealistic expectations from the start. And managing these types of patients is a lot of what makes this field draining, quite frankly. I try my best to educate them, and typically I just don't treat them. Not typically, like all the time. I just don't treat them. But the sad part of that is most patients will just go somewhere else and they'll find someone that will treat them, but yeah, I see a lot of that.
What about the flip side? What are the things that you really love about working in aesthetic medicine?
You just make people so happy. It's incredible. The number of patients I've had crying in my chair just because, you fix their tear trough. They've had these bags for years and they always felt they looked tired. And then, 15 minutes, you just change their life and they look fresh and they can't even believe it themselves. I mean, it's just so rewarding. Those are the patients that it just makes everything worth it. Of course, I love the art part of it.
Yeah.
You're really creating something, and I really treat patients from more of like an aging perspective. I try to keep everyone looking the way they naturally look, but just enhance their natural beauty. So, I mean, it's like I get high, like I'm like, this is awesome. I get to create and help people feel better about themselves. It's wonderful.
If somebody's going to go into or think about going into aesthetics, generally, do you think that they should be expecting to make a little bit less or more than the typical PA, or does it seem to be kind of on par?
Definitely starting off, you're going to probably be getting paid like a new PA or nurse practitioner fresh out of school would, right? Because everybody wants experience. And then moving up, once you've got more experience, I think you'd be making about the same as like any nurse practitioner PA. And then as you gain more experience, I would say like 5 to 10 years in, a little bit down the road, then you'd be probably making a little bit on the higher end. But it's not the field that I would be like, I just want to take it easy. Let me go do some injectables. It's really, truly not like that because you're still dealing with patient outcomes. You're still dealing with people that, remember the patients that are coming in, they're coming in because they're concerned about the way they're looking. So there's a lot of like psychological things going on, emotional things going on. So there's a lot of that as a provider that you're going to be hand holding patients with. So it's not an easy field, but I think you should evaluate what you want. Like, do you like beauty? Are you good with your hands? Or do you see symmetry? Do you like art, being artistic? Like, do you have these little qualities? I think if you do, then you'll be happy and you'll be happy in this field. But if you're getting into it because you think you're going to make a lot of money, I mean, there's a lot of other fields that do very well. And you can do well in anything. So I think the most important thing is that you're happy in the field that you're practicing in. And as long as you're excelling, you're going to hopefully be flourishing in the financial portion of it too.
I think that that is the key to medicine nowadays, especially with the rates of burnout. And why I frankly started this channel is because I think that if people find where they belong in medicine, that really makes all the difference, more so than compensation, benefits, that kind of stuff.
I absolutely love what I do. I'm still learning every day. I learn little pearls all the time. So if you really want to excel, you have to love what you do because you're constantly learning, you're constantly growing, and then if you want to be able to do that, you have to put the time into it.
So that's perfect segue into talking about the learning and the growing. So you already mentioned that if this is something that you are thinking that you want to do, that is the first step that you would advise is to shadow.
Oh yeah, I think shadowing, if you can find someone that's willing to let you shadow, mentor for a little bit, see how you like it, that would be a wonderful way to step into it. Then you can maybe start off with like a weekend training and then get some injectables and practice on your friends and family. And that's definitely the way I would go about it. Do some shadowing, do some trainings.
The manufacturers of the different products, right? Do they offer regular trainings like teaching you actually how to inject and things?
So if you're already a provider that's working and you're ordering from them, they will offer you trainings, but they don't offer trainings to new providers.
Okay.
So if you're not in the field, I offer private trainings in office. You're welcome to check out my website, galaderm.com. I really create the training schedule for the provider. depending on, their skill set, where they're coming from, where they want to go. It's really customized. So you can reach out to a local injector or myself. And then there's companies that offer trainings as well. Like you can look up like aesthetic trainings. Usually those you don't get a lot of hands-on experience with, but it's a great stepping stone. But if you're looking for hands-on experience, which you're going to need for sure, then I would definitely want something with a provider with, at least a minimum of 4 hours training. There's a PA conferences, nurse practitioner conferences specifically for aesthetic medicine. You can attend some of those. They have workshops where you can do get some hands-on training there as well. Most med spas are looking for like 2 years experience. So you definitely want to get some training under your belt. You definitely want to do some mentorship. You definitely want to get to know some people in your area so you can get your foot in. It's actually not an easy field to get into.
Like I said, I'll have the links below for how to reach, Cheatham, and to, if you're interested in talking with her about courses. Now, you're in Florida, so that would be people would have to travel to you, right, for these
Right.
courses. Yeah.
Right. I do train for other companies as well. So if they wanted to train with me through, like Mint or Jeuveau or Versa, if they're already like in the aesthetics realm and if they're going to be doing an order, then I can like train them. It would be free for them to come
Oh,
and
okay.
train with me. Or some of the companies I go out to them too. It depends on what the company is.
Well, I think I'm out of questions. I appreciate your time, Cheatham, and thank you so much for kind of letting us have a glimpse into the world of aesthetic medicine.
It was a pleasure.
I loved what Cheatham had to say about this specialty, that it needs to be a specialty that you really love in order to go into it and to enjoy yourself. Otherwise, I can see it being fraught with lots of frustrations, even if the work sometimes may be a little easier than, say, working in an emergency room. So, like Cheatham said, do your homework, do some shadowing, and start doing some training first to figure out if this is an area you really want to go into. If you want to see videos of PAs and NPs doing other specialties or working in cool or unique jobs, then watch these videos here or go to my main channel page. Thank you so much for joining me today, and I'll see you next time on the Medicine Couch. Bye.